In 2012, Vermont, along with many other states, saw a big increase in the amount of whooping cough cases. Since the Vermont Department of Health is stepping up efforts to educate the public on why getting the pertussis vaccine is so important, especially if you have an infant at home or one on the way. Pertussis is a disease of the respiratory system. It's most severe in children under the age of 1.
Well, most typically, the symptoms of pertussis are a person will begin with usually cold symptoms and a kind of an irritating cough. However, as the cough progresses, that becomes severe. And we often see after a severe cough, the person may have, we call it a whoop. They cough very hard, and it sounds like at the end of that cough, like they're catching their breath. And that's like a whoop sound. The person may also cough hard enough to turn blue, to stop breathing momentarily, or the person may cough hard enough and at the end of that spell, they may vomit.
The Vermont Department of Health suggests all pregnant women get the vaccine during their pregnancy to protect the baby after birth.
The importance of that is to protect the baby when the baby's in utero. That protects it by the antibodies building the protection for the baby when they're in utero. So that does protect the baby for the early stages until they get that first vaccine at 2 months. So it's really important for pregnant moms to get that vaccine.
Vermont follows the guidelines set out by the Advisory Committee on Immunization Practices.
The vaccine pertussis comes with a combination vaccine, so it comes with the diphtheria, tetanus, and pertussis. And when you're an infant, the schedule starts 2 months, 4 months, 6 months, 15 to 18 months, and then they get a booster shot at 4 to 6 years old. They'd like to get that earlier, the 4-year-old, before they go to school. For the adults or for the adolescents, they get the Tdap, which is the tetanus, diphtheria, and pertussis vaccine called the Tdap that is 11 years old. However, you can get that as early as 7 if they're behind on vaccines. That would be something you'd want to talk to your provider about to get a catch-up schedule. An adult will get the vaccine, which is the Tdap as well.
If a person is ill with whooping cough, they are actually contagious for up to 3 weeks after the onset of cough. So, however, if they do see a doctor and they're diagnosed and the doctor does order an antibiotic, then the contagious period does shorten. So the person after 5 days on antibiotic is no longer contagious.
The Vermont Department of Health office here in Rutland, inside the Asa Bloomer building, offers a Tdap clinic on the 4th Thursday of every month. The vaccine is free to those who qualify. The nurses say it's important for the public to know that pertussis is spread through respiratory discharge and that it's crucial for anyone around babies to be vaccinated.
So that person that has that severe cough is actually able to expose that bacteria to other people, and typically that would be the people that are close contacts around him. So we generally say people who are around that person for several hours a week. We want to look at them as being a person that we would consider at higher risk.